මේක මේ පාමිසියකින් ගේන්න කිව්වා පාමිසියකෙත් නෑ මේ බේත.
ඔපරේෂන් 3ක්ම කළා තියෙනවා. ඉතින් බෙහෙත් නැහැ. ඒ තරම් අසරණයි අද මිනිස්සු.
බෙහෙත් නැහැ කියනවා. දැන් පාමසියෙන් ගන්න ලියලා දීලා තියෙනවා. ඉතින් අපිට පාමසියෙන් ගන්න සල්ලිත් නැහැ.
එළියෙන් ගේන්න කියලා කිව්වා දැන් ඔය අර කටු වටුයි ඔක්කොම. අපි ICU එකේ දාලා තියෙන්නේ ලෙඩ ඇවිල්ලා.
Sri Lanka's public health system is free of charge, but faced with a devastating economic crisis, the system has come to a near standstill. When the country ran out of foreign reserves to procure vital imports of food and fuel, the effects to the health sector were more visceral. Pharmacies ran out of medicine stocks and hospitals suspended surgeries. The once lauded healthcare system was on life support.
Even at the present, situation is endangering to their lives. So I can't make it any more comments. It's a death penalty will be there.
The crisis came forewarned. Medical staff across the country and unions such as the Government Medical Officers Association made alert of this issue. The why behind the crisis is simple. Over 80% of the medicines used by the healthcare system are imported and are not produced locally. The lack of foreign reserves made procurement of drugs difficult for both public and private importers. Many of the items in medicines are subject to price controls that couldn't keep pace with the devaluing rupee. This ultimately meant that importers were reluctant to ship pharmaceutical goods at a loss. Yet, up until mid-April, the government denied the medicine shortage in the market. However, by the end of the month, there were 100 medical items in dwindling stocks.
ඉදිරියට එන මාස 3ක පමණ කාලයේදී ඖෂධ සැලකිය යුතු සංඛ්‍යාවක හිඟයක් ඇති වෙන්න පුළුවන්කම තියෙනවා. හැබැයි එයින් ඇතිවන බලපෑම අවම කර ගැනීම සඳහා අපි හැකි උපරිම ආකාරයෙන් කටයුතු කරලා තියෙනවා. විශේෂයෙන්ම අපි දිනක් කර දිනක් අමාත්‍යාංශයේදී මේ පිළිබඳ සමාලෝචනයක් කරනවා. මේ සම්බන්ධයෙන් අදාළ වෙන සියලුම නිලධාරීන් ගෙනල්ලා ඒත් එක්කම ඖෂධ නැති රෝහල් සඳහා ඖෂධ තියෙන තැන් වලින් රීඩිස්ට්‍රිබියුෂන් එකක් කිරීම සඳහා විශේෂ වැඩපිළිවෙලක් අපි යොදලා තියෙනවා.
By the end of May, reports suggested that over 150 medicines and items were in acute shortage across Sri Lankan hospitals. Among them are vital medications used to treat cardiac and cancer patients. And yet, it was not the economic crisis alone that was the cause of this shortage. Corruption and mismanagement has also played a devastating role in this. One such example would be the Cope revelation of an inventory management software for the State Pharmaceuticals Corporation of the Ministry of Health that cost a massive 644 million rupees. The software, which shouldn't have cost that much to begin with, according to the officials, had many problems and took 7 years to be built. All of these claims were immediately denied by the software developers contracted to build the software, who claimed that it only cost 233 million rupees, leaving the balance unaccounted for. Scarcity of drugs, and add to that power interruptions, meant that routine surgeries and operations had to be postponed in many hospitals in the country. As a result, citizens have had to find workarounds to finding medicines that are missing in the market. And right now, Sri Lanka is relying on foreign aid that comes in as financial assistance to buy drugs, or expats to fly in medicine, which isn't the most sustainable way to go about doing things.